Good afternoon, everyone. Can you hear me? Okay. Thank you all so much for your ongoing patient support for our people in the U.S. API. It's truly a privilege to be given this opportunity to share our stories with you. My name is Angela Techur Pedro. I'm from Palau, and I'm an epidemiologist as well as the PIHOA Primary Care PIHOA Pacific Basin Primary Care Office Coordinator. The title of this presentation is a critical challenge for the U.S. affiliated Pacific Islands, sustainable health professional workforce sources to strengthen healthcare systems and hopefully improve outcomes. And the expert of this field couldn't make it, so please excuse my shortcomings when I try to present the part for him. We have many health workforce capacity building challenges in the region. Among these, three main ones stand out, and they are, first, absolute shortages of trained health professionals. Many of the current health workforce are undertrained, and our educational systems charged with educating students to qualify for science-based health career programs share the same problems that the health sector share. And this table here, Table 1, is kind of an illustration of the health workforce shortages that we have. And so on the column title, it says expected primary medical care providers. So that's just providers like family practice, general practice, pediatricians, OBGYN, internal medicine. And the expected number is based on a formula that HRSA uses to standardize the number of providers that should be available, primary care providers that should be available per population. And so, and also a primary care provider is defined by the Code of Federal Regulation for CFR 42 Part 5, and it describes a provider to be a U.S. licensed MD or DO. And so when you look at the numbers for American Samoa, for their population, they're expected to have 16 primary care providers. Their actual number is 28, but based on the HRSA's definition, actually only 2 are eligible. And so it gives an example of the shortage, and it gives an example of the undertrained according to the US standards. And then you look at Guam, the expected number for their population is 46. The actual number according to the licensing office and CMS is 180. And we could only locate 47 who serve a Medicaid-eligible population. And so just from looking at that number, within our region, we have a lot of health disparities in comparison to each other. And so this table is really just to illustrate that point, comparing numbers using kind of a standard approach to describe the qualifications of our health professionals in the region. I'll look at my notes to make sure I remember. So many have reviewed reasons for this ongoing critical challenge in the region, and 2 reports in particular provide comprehensive descriptions of some of the barriers and facilitating factors. And these reports are the Institute of Medicine report of 1998, Pacific Partnership for Health, and then Pacific Health Dialogue in 2007, Volume 1, titled Developing Human Resource for Health in the Pacific. And they came up with Figure 1, abbreviated logic model map, explaining some of the reasons why students from the US API don't succeed. And so from that, I kind of extracted key barriers, which is inadequate educational preparation in English, math, and science. Number 2 is inadequate socialization process, the environment not as conducive for higher education, and then of course limited resources for the regional infrastructure, expertise, therefore requiring distance learning, but that also costs money. And then the key facilitators that those that have succeeded shared were strong early educational foundation in English, math, and science, family and government financial support for training, and group training closer to home, culturally tailored to the U.S. API population. And so I know this is a lot of ask for our population, but that's what has been stated as factors that have prevented success or have facilitated success. And so, what is PIHOA's contribution to clinical workforce in the freely associated states? So the following slides are just but a few examples of PIHOA's partnership for primary care workforce training programs in the freely associated states. And you've heard these examples from Dr. Durand and Emmy earlier, so I'm just gonna highlight them real quickly. And so PIHOA is in a good place to do this because historically, they've been successful in addressing the key barriers and key facilitating factors to enable the Pacific Islanders to succeed in workforce training. And an example is in 1987 to 1996, in partnership with the University of Hawaii John A. Burns School of Medicine, HRSA, and with support from the congressional leaders from Hawaii and American Samoa, they established a Pacific Basin Medical Officers Training Program in Pohnpei, Federated States of Micronesia. And so it was designed to train students from the islands in the islands. The goal of this program, which was to graduate 70, the goal of the program was to graduate 100, but they graduated 70. But that's still a good success for a training program in the islands. That's about 70% success rate. And I'm a third graduating class of that program. Okay, then, and so because PIHOA has history, it's in a good place to partner with institutions of higher education or expertise in the region to conduct this kind of training that specifically addresses the barriers and facilitating factors that I talked about. And one example in 2016 to now, the Doctors and Dentists for Tomorrow, which Dr. Duran had mentioned. It's a 2.5-year program for high-performing Micronesian high school students. It's placed in Pohnpei College of Micronesia in FSM. Let's see, where are we? And this is in partnership with Fiji National University, Federated States National Government. The goal is to generate or produce critical mass of cohort of students that can matriculate and succeed into medical programs or nursing programs or public health programs. Okay, then there's the RMI community-based nurse practitioner training program, collaboration between PIHOA, College of Marshall Islands, and Fiji National University. And again, good kind of success. They enrolled 17. So far, they have 15 students still going strong. Then the next few slides looks at PIHOA's contribution to public health workforce training programs. And these are just some of the examples of their success, public health training programs. So undergrad public health training in the freely associated nations, College of Micronesia, partnership with College of Micronesia, Palau Community College, College of Marshall Islands. And then there's the accumulative training activities by Pacific Island Public Health Training Center, which is, again, College of Micronesia, University of Hawaii Area Health Education Center, University of Arizona, and Western Regional Public Health Training Center, which is comprised of the freely associated state nations, Arizona, Nevada, California, and Hawaii. Then there's a bachelor's in public health nursing, partnership with Fiji School of Nursing at the Fiji National University and Palau Community College. In May 2015, they graduated 17 senior nurses from the Republic of Palau. And this is an outcome of a tripartite agreement signed by Palau Palau Ministry of Health, Palau Community College, and Fiji National University. And then the last slide, or 2 slides of this presentation is, hold on, is program number 136, Developing MCH Workforce Capacity in Child Nutritional Assessment and Monitoring in Target Sites in the USAPI. This was a multi-agency partnership between PIHOA, University of Hawaii, University of Guam, Northern Mariana College, Koshrai Department of Health and their community health centers, Palau Ministry of Health and the community college, and Pacific Chronic Disease Coalition. And when we started this, it was really for research, but because child overweight and obesity prevalence numbers were inconsistent, depending on the source that you look at in the region, we decided instead of using the data, existing data, to train the MCH workforce in best practices in child overweight, obesity, nutritional assessment and monitoring. And this is based on our effort. This is in alignment with PIHOA's board resolution number 4801, which is the declaration of NCD emergency crisis in the USAPI, and also CDC's mission to conduct critical science and provide health information that protect our nation. We wanted to complement the existing monitoring efforts in youth and adults by expanding our work to assess NCD risk in earlier life. Early child overweight obesity is an early sign of fetal programming of adult susceptibility to obesity and related non-communicable disease. And because, we received funding support from CDC OSTILTS through the National Association of Chronic Disease Directors, and we went out to 2 target sites because of limited fundings, and we conducted this training. And it was really just reteaching the workforce how to accurately measure height and weight. And then because of the Zika surge, we decided that we're gonna also train them in measuring head circumference in anticipation of the macrocephaly, a sequelae of the Zika virus infection of pregnant women during the outbreak. So the conclusion, so PIHOA is providing clinical and public health workforce to the freely associated states. It also is strengthening clinical and public health workforce for the freely associated states. As a result, there's high employment rates among its program trainees, high matriculation to undergraduate, high matriculation to professional schools, and related to the MCH capacity training, improve measurement reliability, data quality, build a culture of research approach to routine health data collection so that we can better inform health decisions and policy. And again, I would like to thank CDC leadership, partners and staff, PIHOA leadership, and everyone who took the time to be here. Thank you, masulang and mahalo.